Welcome to another installment of the WeTrials Podcast. I'm your host, Shweta Sapra from WeTrials, and today we have two esteemed guests with us to tackle the important topic of youth brain health, just in time for the reopening of schools and colleges. Dr. Alireza Mansouri is a neurosurgeon dedicated to clinical trials and is devoted to simplifying and supporting patients in the clinical trials processes. We're also honored to have with us Lisa O'Leary, a licensed attorney and a passionate volunteer advocate championing the cause of brain tumor awareness and recovery. Thank you guys for joining us today. Let's begin with our first segment. Brain health issues are quite significant and often overlooked among students. It's critical to raise awareness about these issues for their academic success and overall well being. So, Dr. Mansouri, what encompasses brain health in youth?
First of all, thank you for having us and hosting this, and I'm honored to have Lisa here. Hi, Lisa. As a physician, I see the health of the brain encompassing the entire biopsychosocial spectrum, which not only includes assessment for signs and symptoms that a neurosurgeon typically considers, such as headaches, seizures, or neurological deficits, but also the mental and emotional well-being of the individual. The trouble with issues relating to the brain is that they rarely show themselves in an obvious way, especially mental health, and especially in youth who are very active and otherwise healthy. That is why we need to be aware of them as clinicians and raise awareness as a community.
These are very good points. And I think we can all agree that mental health issues are more common than we used to think, and they affect individuals from all age groups. So, Lisa, could you shed some light on why it's especially crucial to be on a lookout when it comes to the youth?
Well, I think for young people, this incredibly dynamic and transformative phase of life is it's also a prime time for developing mental health issues. It's a time when individuals are laying down the foundations for their future, be it academics, relationships, or personal growth. And any disturbances in brain health can profoundly affect any of these critical areas. And so, for instance, when my husband was diagnosed with glioblastoma, grade 4 brain cancer, it really made me reflect on how essential mental well-being is at every stage of life, especially during youth. And I often found myself wondering, what if things were different? And what if we had more support or identified signs earlier? And that's why I firmly believe that awareness and timely intervention, robust support system, and all of these things can truly make a world of difference for young people.
Lisa, you brought forward some very valid points, and you've truly paved the way with brain tumor support discussions. So, in your experience, how willing are young individuals to reach out for assistance?
It really varies. It's kind of all over the place. Many people are initially really reserved. They're filled with questions about symptoms and how to approach mental health services and ways to tackle the stigma and boost overall well-being. And those apprehensions definitely resonate with me deeply. When my husband's diagnosis with brain cancer came through, I often found myself shying away from information, largely due to the really intimidating statistics that went along with his disease. And I was diagnosed with PTSD 6 months after he died. And, things would happen to me, like I would hear a siren from an ambulance and I would start having a panic attack. And I really do think if I had sought therapy and supportive care for my mental health sooner during the time that he was sick, and rather than waiting till after he was gone, perhaps my experience would have been a lot different.
This is very inspiring, Lisa. And thank you so much for sharing this with us. So, Dr. Mansouri, coming to you, given the complexity of mental health issues, do you think there are any resources for young adults or their families who are dealing with these issues?
I think it's important to be aware of the resources available and being aware of them in a timely fashion. Like Lisa, that was a great point you mentioned. Like when you were going through the difficult times with your husband, whether you were shying away from it or you were not aware of these resources. So I hope that by raising awareness on these topics as physicians, clinicians, and patients and advocates, we can bring it to the forefront so people are ready when they have to deal with life challenges, like you mentioned. So some of the organizations that I've found to be potentially helpful include Substance Abuse and Mental Health Services Administration, or SAMHSA. They stand as a beacon, offering insights into challenges young people face regarding mental health and substance use. We also came across the Youth Mental Health Project. This initiative extends its hands to our youth and families, providing them with essential resources, helplines, and a wealth of learning tools.
Any resources you would like to add, Lisa?
Yes. The Family Resource Center by the Child Mind Institute is another really good resource, giving parents and guardians expert-led videos, informative guides, and even a feature where they can directly ask experts for advice. And for those seeking a more medical perspective, the Medical Home Portal presents a range of screening tools. I've also collaborated with the National Brain Tumor Society to create a virtual support group along with another patient advocate, Adam Hayden. And that has been, from what we hear from the feedback from our members, a real lifeline for many people.
Just to add on to this, even here at WeTrials, we are dedicating our Thursdays as WeTrials Thursdays to share vital information through our blogs and podcast to help and spread the word and enlighten more people about mental health issues. So moving on to the next segment, brain health issues can unfortunately hit us at a very young age. So Dr. Mansouri, could you elaborate or discuss some symptoms that students may experience?
Yeah, absolutely. Brain health issues, unfortunately, don't really discriminate by age. They can affect us indeed at a very young age. And some symptoms that people may experience include changes in mood, behavior, personality changes, difficulty concentrating or paying attention, which is critical for when you're going through your education, changes in eating or sleeping habits, loss of interest in activities they used to enjoy, feelings of sadness, hopelessness, or worthlessness, thoughts of self-harm or suicide. And when a brain tumor is the underlying culprit, which it can be, a wide range of other symptoms can also be seen, including headaches, nausea, and vomiting, especially worse in the mornings because the pressure in the brain is highest in the mornings, seizures, weakness or numbness on one side of the body or face. And on top of that, changes in mood and personalities. I've had several examples of very high functioning individuals who gradually, let's say, lost their practice and got in trouble, but it turns out it was a huge right frontal tumor affecting the personality. So it's important to emphasize that these are perhaps no different than the symptoms that anyone else may experience, but that they may go unnoticed or they may be dismissed, given that the presumption is that you're young, so you must be healthy and doing fine. In fact, when it comes to glioma patients, we did a study recently to investigate the prevalence of depression and anxiety in individuals with low-grade glioma, which is a tumor that's typically diagnosed when you're young, in your 20s, 30s, and 40s, and you're otherwise healthy. And we found the prevalence of anxiety and depression to be upwards of 50%. So as specialists managing brain tumor patients, we need to be very mindful of this. I've started personally incorporating screening for mental health issues among the brain tumor patients that I have in my practice, just, casually asking how they're doing, how's their mood, and perhaps involving anybody who's in the room with them to make sure that we're not missing it.
That's a very crucial insight, Dr. Mansouri. And it underscores how pivotal early detection and understanding can be, especially when these symptoms can be dismissed due to age. So, Lisa, just building on this, if parents, friends, or teachers spot these signs in a student, what proactive steps would you recommend that they take?
Well, I think, the most important thing at really any stage of life is to have genuine, open conversations with the students about what they're feeling. And really, as I said, that applies all up and down the board. It goes even from, you think about the way we talk to children. And if they're, I noticed this, I have 3 little nieces who are 9, 8, and 4. And I noticed, like, when they're sad or they're crying or they're upset, the response tends to always be, stop crying, don't cry, it's okay, don't cry. And I didn't learn until many years later, working with my own therapist, that was really dismissive of the feelings. And so when I'm talking to them, if they're crying, I inquire into, what is it that's going on that's making you feel that way? Are you feeling sad? What is that sadness coming from? Because really, all a lot of people need is to be validated with their feelings. And often that is not the way that we do it in this culture. We are just taught to, like, pull yourself up by your bootstraps, tough it out, and And that can be really, really dangerous and detrimental to people who are suffering from mental health issues. And so monitoring any changes in behavior is crucial. And it's not just about recognizing the signs, it's also really encouraging people to seek professional help if it's needed. And while guiding them towards these professional resources, the importance of emotional support and understanding cannot be stressed enough. It makes a huge difference. And I know for me, when I was going through experience of my husband's illness and then grieving him after his death, you know, it became very apparent who was able to be there and show up for me and who wasn't. And there's no judgment on the people who weren't. But having the people who were able to show up, even if there's only one or two of them, I will tell you, was an absolute lifeline for me. And so we may be uncomfortable about talking about these topics, but if somebody is genuinely suffering, they really do need that support. So, and certainly I am a huge advocate of professional intervention.
Such great points, Lisa. And the temptation for most of us always is trying to like fix the problem, but sometimes people don't need fixing. All they need is a listening ear and having their emotions labeled in case, you know, they can't quite put their fingers on it, and being validated. And from a professional side, it's not infrequent that I've had cases of students doing well in school, but then gradually declining, only for us to later find out that they've been having seizures or some sort of a, you know, tumor that's been affecting their, or from an old brain injury that's been affecting their ability to concentrate. It's important to have people who are genuinely interested in your day-to-day and your overall well-being, open lines of communication, so that these gradual declines can be noticed. You know, like, you know, a teacher who sees you for 1 or 2 classes a week may not pick that up, but if someone who is a friend or a family member is astutely observing, that can be helpful.
I completely agree. And it goes to show like how under the surface some of these issues can be, and the importance of and actually how crucial it becomes that they're detected early on. Coming back to you, Lisa, what would your advice be for those who are hesitant to seek out help?
Well, I certainly know and empathize with people who are hesitant, because there is unfortunately still stigma associated with having mental health challenges. I personally speak about mine very openly for the purpose of really trying to destigmatize it, and saying, like, you know, you can look at me and I look like, you know, I've got my hair done, I have the, you know, things together, but you don't know that I'm dealing with anxiety, depression, or PTSD. And you can't look at somebody and necessarily know that. Mental health is not just a person who's sitting in a room with padded walls, right? Which is something that those visuals that I conjure up, or I used to conjure up when I thought about mental health issues. And I think that a lot of people think that reaching out for help is some sort of weakness, and that, you know, they should be able to handle things on their own. But the truth of it is, in my experience, and in the experience of anybody I know who has sought mental health treatment, is that really truly shows how strong you actually are to be willing to ask for help. You know, and a lot of people face mental health challenges. I would say, you know, far more people than are maybe even aware of it face mental health challenges. And there is help out there. You know, medical folks are specifically trained for this. And for those caring for others, like being a care partner, it's really important to recognize the signs, like changes after somebody has a seizure. My husband certainly had. He did not have a frontal lobe tumor, but you'd have sworn he did because of the difficulties with behavioral changes that he had. And at the end of the day, it all boils down to ensuring safety and truly understanding the situation. And, you know, if you are a care partner who has somebody you're caring for who is not very willing to seek help for themselves, it's important, I believe, to seek help for yourself, to learn how to deal with somebody who may not be willing to deal with those issues. So there's certainly no shame in reaching out for help. And I definitely think that, I know that if it weren't for the professional help I've received over the years, I wouldn't be sitting here having this conversation.
You know, Lisa, it's a very good point that you bring that up, in terms of someone may look like they're very well put together and they're doing fine otherwise, Like I've had patients who, as a surgeon, I'm happy that after surgery, they haven't had any neurological deficits, but then they're kind of upset because they have the stress, they have the anxiety going on, and no one is there to support them because on the outside, they don't look like they have any disabilities. So it's a very good point you bring up there.
You both bring up very valid points about the early detection and overcoming these barriers. So, this naturally leads us to consider what comes next after identifying the problem. So, once a problem is identified as a patient or as a care partner, there may be several treatments available, from therapy to medication. So, Dr. Mansouri, given your background in clinical trials, could you shed some light on this? And what is your advice to individuals for navigating decisions about the treatment options?
Well, the first step is to see the correct specialist. Oftentimes, an issue is first noticed by the primary care provider. At this point, a range of options are available, including screening tools like brain check platforms, MHA screening, brain injury screening tool, mental health screening for children and teens, and then obviously the standard routine things that we do, the diagnostic tests such as CT of the brain, MRI brain, and referral to the appropriate specialists. These specialists can be psychologists, psychiatrists, neurologists, or neurosurgeons. A psychologist can help with counseling and working through stressors and life events, while psychiatrists are able to prescribe medications. When it comes to counseling, there are a wide range of options available, including cognitive behavioral or family psychotherapy. Neurologists and neurosurgeons have very complementary roles. While neurosurgeons typically manage conditions related to a structural issue, such as brain tumor compressing the brain, or a lesion causing too much brain activity and causing seizures, neurologists manage other issues of the central and peripheral nervous system that are not amenable to surgery, such as some forms of seizures, headaches, strokes, etc. When deciding on the management options, it's important to do some research and consider the evidence, but I realize that this can be challenging with all the medical jargon and the massive amounts of information out there. Talk about Dr. Google. Your specialist should be the first resource to ask about clinical trials, but there are now plenty of advocacy groups representing others who may have gone through the same diagnosis or experiences. So that could be a great resource to reach out to as well. Lisa, given your experience in advocacy, what do you think?
I agree with everything you said, and I think it's really important to tailor treatments to each individual because it's not a one size fits all situation. Some people may benefit more from seeing a psychiatrist and getting their symptoms managed with medication. Some people may not need medication, but do need to have counseling. So a psychologist would be the better tool. And looking back on my own experience, I wish I had known that there were more experiences or more resources than what I thought there were. And for example, I've done several different types of trauma therapy, and one of them is EMDR, which is trauma targeted. Also, I've done hypnotherapy. I mean, these are things that if you had told me like 20 years ago that I was going to go to a therapist and hypnotherapy, I would have been like, you're out of your mind. That is not, I would never do that. But when I get to that place where it's like the gift of desperation for needing help, you're willing to try anything. And I really did have some success with that, but I didn't know that those things were out there at the time. And even some of these things, a lot of these things can be done online. My own therapist that I see, actually, I just saw her before this, and I was in the same sort of setting. It was online. We see each other face to face in that electronic way, and through technology instead of face to person. And addressing things head on and really dealing with things from the outset of something like a brain injury or illness is a huge game changer. I'm a really big advocate for palliative care. When my husband was sick, I didn't know the difference between hospice and palliative care. And so I heard palliative care and I heard you're giving up, that we're not going to be treating you anymore, and you're not going, and I was just not prepared for that. I thought it was just like hospice. And looking back now, knowing that like you can absolutely be in active treatment while you're on palliative care. It's just another resource to support you while you're going through these things. Man, that would have been such a big deal. And if we had heard about that and learned about it from the get-go, it might have made things a lot easier on both me and my husband, and it's not just about the therapy sessions, but like regularly touching base and seeing how things are going.
Yeah, such a good point. And I think one other thing too, I think we've talked about this before, Lisa, you mentioned it, is just like how we want to advocate for integrating palliative care conversations very much upfront, like soon around the diagnosis. It's good to talk about mental health challenges and options available very early on as well, right? Just bringing it all to the forefront. For many individuals, especially students or young adults who haven't had to deal with healthcare much, getting access to the right specialist is super tough. Sometimes there aren't enough of them around. I'm glad that there are now virtual options, or they might take only certain insurances, and the cost can be exorbitant. That can be a big roadblock. Lisa, do you have any advice for navigating such challenges?
I do have some, because I do have experience with this as well. For people who are stuck in those tricky kind of situations, it's really about reaching out, asking for recommendations from healthcare professionals who come highly recommended. And, it's really important to know that there are resources out there for people who do not have insurance or who do not, they're not able to find a doctor that accepts their insurance. There are services out there that people can reach out to, especially if you're in the brain tumor community. The National Brain Tumor Society has a patient navigator, and you can reach out to her and she can direct you to kind of like, where do you go with that situation? Because I've had that happen. Even my therapist dropped off of my insurance panel and I started to have to pay out of pocket. And, it can be really, really challenging. But I will say that whatever those challenges are, generally speaking, even if they may be a little bit difficult, there's usually a solution to get around them. And it's important enough to put in the effort to find those solutions. And it's also, remembering to go to those who prioritize finding, if it's a psychiatrist, for example, the right amount of medication, not over medicating, not under medicating, because those things can be a huge factor too. And having a doctor who really understands the different types of medications and how they, the side effects and the interactions with other medications. There are people out there to help. And it is unfortunate in our system that there are a lot of people who have, especially marginalized communities who don't have as much access to this type of care. But there are things that can be done and can be found out there. And they're extremely important, in my humble opinion.
No, thank you. And I just had to, on that note about under medicating and over medicating, a lot of people may have hesitancy or, again, the stigma about medication, like, oh, you're being medicated. But I always say, like, high blood pressure, you take a blood pressure medication. You don't have enough thyroid hormone, you take thyroid hormone replacement. So there's neurotransmitters and brain hormones. So what's wrong with that? So good point.
Well, I think it's incredibly important. And, I think we may have shared about this with each other before, but my husband had the experience that he did not want to be on medication for anything to do with mental health. There are a lot of reasons behind it, but he was very adamant he did not want that. But he was extremely depressed, and he had extremely difficult to control mood swings and psychosis even that was associated with his seizures when he was going through his brain tumor treatment. And so I had to get a little bit creative and work with the doctors to explain to him that the medication that we were going to administer had to do with exactly what you said, which is just evening out, the chemical imbalances in the brain, rather than calling it an antidepressant, and sometimes like that wording for people can make such a huge difference with how you present it. And somebody who might say, oh, I'm never going on antidepressants. But if you say, oh, hey, but you have this chemical imbalance in your brain, this can probably even you out. It might make things go a little bit smoother. There might be a little bit more willingness for those who are still a little bit in the stigma.
Yeah, absolutely.
Thank you so much. We definitely had a lot of fantastic insights from both of you, and they're going to be truly invaluable for our listeners and viewers. And as we step into the new academic year, it's crucial that we recognize and respond to these early signs of brain health issues. So, our chat with Lisa and Dr. Alireza today was all about equipping students, parents, and educators with the knowledge they need. So, stay with us on this journey into youth brain health. Until next time, thank you for being part of the conversation and for tuning in. Thank you,
Thank you.
guys.
Thank you.